Well, I like to always point out two common problems that I see in my practice every day, and that those are erectile dysfunction, or what we call ED, and sleep apnea or snoring. So, erectile dysfunction is notoriously caused by cardiovascular disease, and we didn't make that connection until about the early 2000s, shortly after the Viagra drugs came out, because we started giving out Viagra like candy because it was the first orally effective erectile dysfunction medication, and it came out around 1999. And about 5 years later, we saw our patients coming back telling us that they had their first heart attack. And that's when we first started to realize that there's some connection to it. And it wasn't that the Viagra was causing heart disease. It was just we weren't recognizing at the time initially that ED was actually a symptom of heart disease. And so we started looking at this more rigorously, and we started stratifying men, and we realized that actually men who present with erectile dysfunction are at risk for cardiovascular disease. So our paradigm has changed now such that when men come in complaining of, hey doc, it's just an erection problem, just give me that pill and I'll be out of your office, we say, sure, we'll get you the pill, but let's get you to a cardiologist, let's get you evaluated so that we can understand if there's anything more serious under the surface. The second problem is snoring. And I don't know how many millions of Americans snore every night when they sleep, but typically it was thought of as just a standalone annoying problem for your partner. Obviously, you don't know you snore, but your partner gets annoyed by it. And oftentimes I'll hear from my patients, oh, but my wife doesn't care that I snore. Well, snoring is a definite sign that the patient might have sleep apnea. And sleep apnea is another one of these problems that for the longest time we haven't recognized. And just to put in perspective, when I was doing my residency, and that was 25 years ago, we didn't do a single sleep study. And we had all kinds of sleep apnea related complaints, like guys would tell me, hey, doc, I get up at night to go pee all the time, but I'm fine during the daytime. And we would treat them with medications, we would treat them with surgeries, and nothing would help. But the one thing we didn't do 25 years ago is check a sleep study. So now we understand that sleep apnea is associated with things like getting up at night, but it's also associated with more serious conditions like arrhythmia, stroke, and hypertension. And so the cardiologists and neurologists are also equally looking and trying to identify patients who have sleep apnea and get that under control. Well, let's start with prostate cancer. The AUA, or American Urological Association guidelines, currently recommend checking a PSA annually for each man. And if they have a first degree relative who's had prostate cancer or are African American, we recommend pushing up that screening to about 45. So we want to identify these guys early, because prostate cancer, not only is it the number one cause of cancer in men over the age of 50, it's also a very curable cancer if we catch it early. Men don't need to die of prostate cancer. For heart disease, cardiologists typically recommend getting your cholesterol and blood pressure checked annually. Other things that can help with identifying cardiovascular disease are electrocardiograms, EKGs, and stress tests, which they can perform in their offices. And the third question is diabetes. Again, nowadays we have these great devices that are essentially available over the counter called continuous glucose monitors, or CGMs, which a lot of patients are using even when they're not diabetic. But traditionally, in the medical practice, we would check a hemoglobin A1C, which gives us a nice average snapshot of 3 months of what a man's or woman's or patient's average blood sugar was over that 3 month period. And that's very helpful, because in the old days, we used to check fasting sugar one time every 6 months. And so the patients would be fasting, they'd do a great job, and we couldn't pick up those more subtle cases of diabetes because they'd be fasting. Their blood sugar would be relatively normal. But it wasn't identifying, when they were eating those cupcakes and sweets in the middle of the day, the sugar spikes. So the hemoglobin A1C gives us an average blood sugar over a 3-month period. And these continuous glucose monitors now that are readily available over the counter have helped patients identify themselves any abnormalities in their blood sugars. Well, what we're doing is we've identified the specialties that are most important to men's health. And I could say that if you take urology, cardiology, and sleep medicine, you'll encompass about 95% of the problems that men are going to experience in their lives as they get older. So having a fast track to these specialists to get in to get that care that they need and to avoid delays is very important. And so that's really what we're providing. We have a brick and mortar operation at El Camino Hospital that's been in existence now for over 15 years. And what we do is we have specialists come to the clinic as opposed to the patients come to the specialists. And so we have a single facility where we see all the specialists will see these patients under one roof.